Food allergies are more prevalent in children than adults, with anaphylaxis hospital admissions on the rise. But greater awareness, clearer labelling and better provision of care can crucially make all the difference. In this special report, we speak to family members of the teenagers for whom that lack of care cost them their lives.
Rena Chima hasn't set foot in her son Karen Beer's bedroom since the day he died 3 years ago after suffering anaphylaxis at school. His allergies meant his body's immune system went into overdrive after food was thrown at him by 2 other pupils.
One of them had a baguette and he took pieces out of that baguette and started throwing it at my son. The baguette was wheat, it had cheese in it, probably had mayonnaise, and he just started throwing it at my son, and my son started scratching.
Karen Beer recognised the signs and went for help. He was taken to hospital, but it was too late.
He was unconscious by the time I got there. The last time I saw my son was that morning. Can we stop for a minute? Sorry.
Rena believes there needs to be more awareness about allergies, particularly in schools, as children tend to suffer more than adults.
We know school's a risk factor, and so if we can get the first aid education in there, this will help understand food allergies better in schools and probably lead to better treatment, but B, that knowledge will continue with those people into adulthood. And I guess the third element I would suggest is actually more education for schools themselves, for school staff, not just teachers, but other people in schools.
Karen Beer's school did give him an injection of adrenaline, but it was out of date and 1 dose was not enough. 2 doses of an adrenaline auto-injector, known as an EpiPen, are sometimes needed to give patients a better chance of survival. The Spare Pens initiative is funded by the Department of Health and Social Care. It's been set up and supported by the BSACI, RCPCH and patient organisations Allergy UK and Anaphylaxis campaign. It teaches schools to recognise the signs of anaphylaxis, encourages them to keep extra pens and teaches them how and when to use them.
If you've got a child who's having a severe allergic reaction in school, the schools can use their spare pen. So if you've got a situation where actually a pupil has forgotten to bring their adrenaline auto-injection to school, which happens unfortunately, or they need a second one and there isn't a available second one, schools have a life-saving bit of kit on site. Many schools have actually implemented it, and this is saving lives.
Anaphylaxis can occur when the body's immune system overreacts to a particular substance or food. There are around 14 major food allergens, which include nuts, wheat and milk. A law was recently passed to ensure pre-packaged food is clearly labelled.
Natasha's law means that from October 2021, all pre-packaged food for direct sale will have to have a full ingredients list with all the allergens clearly labelled.
Natasha's law was named after 15-year-old Natasha Adnan Laperouse, who died after eating sesame, which she was allergic to, in a sandwich not clearly labelled. Mandatory labelling of allergens does not yet extend to restaurants. Owen Carey died 3 years ago after eating out to celebrate his 18th birthday. His father and sister had been managing his allergies since he was 6 months old. Owen was allergic to a long list of foods, including wheat and dairy, which he always made clear when eating in restaurants.
What we know happened is that he explained to the waiter that he had allergies to dairy and wheat and that he couldn't have certain parts of this meal, so he was going to have a piece of grilled chicken and side salad. And he specifically asked not to have a bun with this grilled chicken because he knew he couldn't have wheat, and he had explained that to the server.
The grilled chicken Owen ordered had been marinated in buttermilk, not mentioned on the menu. He died on his way to hospital.
Has anything changed regarding the menu at Byron Burger?
They've got allergy symbols against all their items on the menu, and they've updated their staff training, so they begin every service with, are there any allergies in your party, on your table?
Emma and Paul want to see this in all restaurants. They're fully supportive of Natasha's law. Now they want Owen's law, under which allergens would be flagged on the menu with universal symbols that everyone can recognise.
We're hoping that they'll listen to us, and we don't mind what they call it. We call it Owen's Law. That's just a nice label for us, but it's really to make sure that restaurants on the face of the menu list those 14 allergens in a clear and concise way. It's just so hard to lose a child, and it's so hard to lose a child in such circumstances. No one should have to go through that.